Perfect. Hello, Nurse Browning.
Hi, how are you?
I'm well. Richard Garland, how are you, sir?
Richard Garland in the room, who I have a tremendous respect for. On this side of the state here in the great city of Pittsburgh, Brother Garland is an institution in his own right, and someone that I have a tremendous respect for. And all the panelists, as well as our political and civic engagement chair, Brother Michael Coghill. I am so sorry, brother. You and I should have talked 100 times before tonight, but we will pick it up tomorrow. This is a great privilege and honor for me to have this esteemed panelist to join us tonight. And I want to give a special thank you to each and every one of you, and particularly Brother Cogbill, who has hit the ground running as our political action and civic engagement chair for the Pennsylvania State NAACP. Tonight, I want to say to those that are tuning in and those that will have the opportunity to hopefully see this recorded, this issue is a very, very serious issue. And I just want to commend Brother Michael for really appealing to the Pennsylvania State NAACP about this issue. For me, I can honestly say, and I think Brother Garland can attest to this as well, this is an issue that must be spoken to, and oftentimes is not. And I get with all the things that are occurring nationally, and you know, the race relations and race situations, and the police shootings and killings of our people. We certainly don't want to minimize any of that stuff. But we at some point we have to address the gorilla that's really in the room, and that's gun violence. And again, I'm going to let Brother Michael Cogbill, I'm going to allow him to work with you all tonight in speaking to this issue and kind of moderate this thing, because I really want to hear your expertises on this issue and on this situation. And I really can't wait to hear from Brother Garland as well, who I consider an expert on this situation of gun violence. So again, on behalf of the Pennsylvania State NAACP, I thank each and every one of you, Ms. Kaufman and Ms. Browning. I certainly look forward to working with you all in the future. Brother Garland, that goes without saying, I owe you a phone call tremendously, because this is something that we have to work on together. So without further ado, and without saying anything else, I want to turn this over to Brother Michael Cogbill. Michael, thank you for allowing me to have the privilege of working with a sharp young man such as yourself. It is indeed my pleasure and privilege, and I look forward to learning so many things from you. So thank you all.
Thank you.
Thank you.
Thank you, President Houston. Really quickly, I did have an icebreaker, but I think we might be doing that all this week after this storm. Like I said, I really wanted to go into, before doing the introductions and telling folks who you are, I really wanted to go into the events that happened last night, and just touch on that narration and the news clip of 8 people shot. When I was leaving where I was coming from, I thought that, even being somebody who has worked in this space, I thought that was targeted violence at Broad and Naomi. It's a major transportation hub here in Philly. It's very busy, but I thought that was targeted violence because of the media. But then when I got home and started to do some research, I saw that a 71-year-old man was shot, young people were shot, a woman was shot as well. So more so, that wasn't a targeted shooting, but the word I'm looking for, and the word that I do want to touch on in these communities, is mass shootings. Really quickly, Eleanor Kaufman, Dr. Kaufman, I should say. I know you did some research on mass shootings in impacted communities. Could you really touch on that to start the conversation, the research you did, why it's imperative to talk about mass shootings from a public health aspect, why it's imperative to talk about that when we're discussing impacted communities really quickly, and how we could potentially, you know, use that lingo, push the word mass shooting for Black and brown bodies when there's more than 2 people shot in the community. How can we push that? How can we advocate for that to somehow get into the media or get media experts to start using that word?
Well, thank you so much. And before I answer you, I just have to say I'm so excited that the NAACP of Pennsylvania is taking on this issue. I'm so excited to be here. It's such an honor, right in the middle of Black History Month, no less. I wish that we had something more cheerful to talk about, but this is the reality, and we have to face it. So I think the research you're referring to is actually led by my colleague, Dr. Jessica Beard, so credit where it is absolutely due. The term, and I think words do matter, like you're getting at. And, you know, when we say words like terrorism, we only use them in certain contexts. When we say words like mass shooting, we only use them in certain contexts. So in that research, they found 46, over the course of 10 years, 46 events that should have qualified as a mass shooting just within Philadelphia. And that in itself is tragic. But then when they looked at the coverage, only one of those events was described using that key phrase, and that phrase really, it calls to mind innocent victims. It calls to mind an emergency that we need to do something about. And those absolutely should apply to the folks of Philadelphia who are living with this every day, every week, every year. Those words don't get used. I'm excited that you told me you're going to be talking more about media coverage with my good friend and colleague, Jim McMillan, and probably others, because I think the way we talk about things matters. And we absolutely need to, in a way, reclaim those terms that remind people how serious this is and what an emergency it is. Just because it's common doesn't mean it's okay.
Right. Mr. Garland, really quickly, if I could jump to you, why aren't these shootings in our in impacted communities considered mass shootings? Why does the media have us think that a shooting at a mass transportation hub is targeted violence? Why don't they give us the credit or, you know, narrate these things the way they should in order to protect impacted communities?
You know, I'm going to say, from that vantage point, our community, especially the Black and brown community, has been inundated with shootings every day. You know, every weekend, you know, we see shooting, and people have become so, but I'm not saying that they're immune to it in the African American community, but, you know, it's almost like it's a way of life now. Our politicians, you know, I'm always gonna give it to them. You know, we get more when there's considered a mass shooting, like here in Pittsburgh, when the Tree of Life happened, all those people that were killed, they still throwing money at the Tree of Life and trying to do some kind of prevention. But in the Black and brown communities, almost every day we are inundated with shootings, and we can't get the funds in order to attack it. You know, and we you know, and I had taken a public health approach to it with, you know, getting guys, men and women who were part of the problem, making them the solution. And a lot of guys, a lot of men and women want to change their community, and they got enough juice, excuse me for using slang, but they have enough juice in order to turn some of these young people around. Opportunities help with changing the mindset. We have to change this narrative. That's what we have to do. So this mass shooting, I think, in the Black and brown community happens all the time. We might have one or two in different neighborhoods, but it all adds up. You know, I'm giving somebody else a chance to talk.
Yeah, please, thank you. Because after this, I do want to go into the intros and the generalized questions. I know some folks, just to flag it, President Houston, I know some folks are trying to get on and sending me Facebook messages about the links. So if I'm kind of sending them back to the Facebook page to let them know you can probably get a better link there, but some folks were having issues with the link, so they might be trying to reach out to us. Really quickly, Nurse Browning, thank you so much for joining us. I just wanted to get your input as well on the idea of targeted shootings versus mass shootings, and why the media doesn't narrate the plight of impacted communities the way they should when talking about gun violence, please.
Well, I wanted to agree with Mr. Garland. Just so you know, on the average day that I work, and I work 3 to 4 days a week, and I work night shift. On my average quiet day, I have minimally one shooting, one patient minimally. And usually if there's one, there's more. So we know if we have one call coming to get ready that we have something else in the mix. Rarely do we see it on the news. Rarely, unless it's extenuating, unless it's 8 people that are shot. But this past summer, we had a shooting. 5 people were shot, all brought in separate in individual cop cars. They just kept bringing them in, and it never ever made the news. And I searched the news for that. Never made the news. A young woman, a pregnant woman, an elderly woman, all shot, never made the news. Why is that acceptable? Why is that not newsworthy? If that happened in my town, I can tell you, if that happened in my town tonight, SWAT would be here, the National Guard would be here, everybody would be going crazy. But because they were Black and brown members of West Philadelphia, it wasn't newsworthy. It wasn't, a community outrage didn't occur. And I don't understand it. And I want to understand it, and I want to change it.
Thank you so much. Again, really quickly for the attendees, for the panelists, I keep saying we aren't looking for the answers. There's no right or wrong answer for this, just like you, Nurse Brown, and I want to understand it. That's why we're having this conversation. With like I said, we're starting to build the resistance. I hope it works, and I hope we get some policies passed. But in the meantime, thank you so much for being on. Thank you for this education as well. Like I said, I'm very grateful for your presence. I jump right into the program. The first question I want to ask, can you guys share a little bit about yourself? Why public health is such an imperative dynamic to solving issues pertaining to gun violence? And for a little icebreaker, I want folks to share their favorite restaurant. So when things open back up, folks could potentially have more ideas, but that's it. I'll start with Nurse Browning, because I see your yellow box right now.
Okay. So for why the public health crisis and why gun violence should be and is a major part of that. One thing is the continuing medical issues that these patients are having, these victims are having. It's kind of ironic that such a large amount of people are being, if not killed, severely injured, and potentially, lagging into the medical situation, continually having medical problems, not really fully ever recovering, is pulling. It's pulling on the medical field. It's pulling on these individuals being able to work, support their families, and that kind of thing. It's a huge issue, and it's affecting not just the patient or not just the person that was injured, their parents, their children, me, coming into work every day and having a 15-year-old boy look at me and beg me to call his mother. Like, that's straining. It's life-changing to watch this happen. and to not call it, you know, an emergency, a crisis, is really a wronged event, and it should definitely be corrected.
Thank you, Nurse Browning. Mr. Garland, really quickly, I'm just asking for a brief introduction of who you are. And again, why is the public health aspect of gun violence such a imperative component to preventing this thing? And why do you choose to do this work?
So, I mean, I don't know, I think you know, but I'm also formerly incarcerated. I'm a
Right.
former gang member from Philly.
Right.
I was born and raised in Philly. Because of my involvement in gangs, drugs, and alcohol, I spent over 23 and a half years of my life in the penitentiary.
Tell them where you do research at, though. Like, pipe me up, man.
I'm at the University of Pittsburgh, Graduate School of Public Health. And until I got there, I mean, one of the things, I lost a lot of my homies due to gun violence, you know, back in the 70s, you know, and 80s. You know what, the one thing that I want to say that we really got to concentrate on is apathy. We have so much apathy in our community, you know, that people have become so immune to this crisis. And we here in Pittsburgh are looking at gun violence as a public health crisis. So I really work with young men and women. I'm trying to turn guys around that were part of the problem, making them part of the solution. So the public health approach to that is interrupting the transmission of the disease, because we look at violence as a disease. You know, the second thing that we try to do is stop the future spread of the disease. You know, and then, you know, while we're doing those things simultaneously, we're trying to change community norms. That when we start talking about changing community norms, we're trying to address the apathy that exists in our communities. You know, and the fourth and the most important thing is, to me, is identity transformation. That I'm changing with the way guys used to think, making them part of the solution. So, you know, that's where the public health approach has helped me. I have a project where we call GRIPS, Gunshot Recurring Injury Prevention Services, where we see the gunshot wound victims that come into 4 trauma units here: Presby, Mercy, AGH, and Forbes. Those are 2 different health systems, but they allow me to come in. The social worker will call me or email me, and what we do is offer them services. Depending on what the services that they need, these are the things that we go about trying to get them out of harm's way and directing them in another direction. You know, I think that's the way we really combat these disease. And I got other things going on that add to this, but I want to hear from our other esteemed panelists.
Dr. Kaufman, I've been saying Dr. Kaufman since we jumped on. So, but really quickly, could you give folks a quick intro and, you know, tell us why the public health aspect is so imperative to preventing gun violence?
Yeah, thank you so much. So I'm Eleanor Kaufman, and I am a trauma surgeon at Penn in Philadelphia. And you know, long story short, I became a surgeon because I like to work with my hands and I like to fix problems. And my job is incredibly rewarding. I get to help take care of people and help make people better. But at the same time, I think, like most of us in trauma and most of us in medicine, I'd like nothing better than to be put out of work. I'd find something else to do, no problem. And can I tell a story? I'm going to tell a story. Because, you know, I get to do what I love to do because bad things happen to people, and it's a very strange life. So one of the best cases, we call them cases, best surgeries that I have done in the last couple of years was a young man, like many of our typical patients, who came in with a really bad gunshot wound. He was actually shot in the throat and had an injury to his trachea, his airway, as well as to his esophagus, where he would swallow, and he was really on the verge of death. We were able to get him back. I don't need to tell you the gory details, but we did a really complicated, really cool, really interesting for me surgery. It went really well. I didn't get to talk to him before because he was in extremis, you know, but when he got through it, he was just a lovely guy. Not that that matters, I'll take care of anyone, but he was lovely. His family was lovely. I got to know them a little. And I've been thinking about him and talking about him, you know. And then, you know, Mr. Garland and Rhonda are both going to recognize this kind of story because he came back. He came back to Penn Presbyterian and he didn't make it the second time. So that's why gun violence is a health problem. It kills people, it hurts families, communities, the young people who grow up, you know, witnessing violence. It hurts us all. The other thing, to take it in a totally different direction, the other thing that the public health approach means to me is evidence. So I'm a surgeon, I'm also a scientist and a researcher, as I mentioned. And so when I think about public health, I think we don't have to think about what's right, what's wrong. We're not necessarily even thinking about what's legal or illegal. We're thinking about, okay, what works? And I think a lot of us recognize that gun violence is a problem and a lot of people want to do something about it. And I think the job of the public health approach is to say, okay, who is this hurting? Who is this impacting? And we can't just do something. We have to figure out what works. We got to measure it. We've got to give up on what's not working. We've got to find new solutions and we've got to pay attention to the impact. So we've got to keep our focus on the people who are getting hurt and we have to figure out the best ways to help them. And that's what I think the public health approach brings to the table. We don't just need health professionals, we need everyone, but I think that lens is really helpful.
I had a feeling something would get fairly deep. That's why I also wanted to ask folks what their favorite restaurant was. If I could start with you in the city, is the place you like to eat, and then I can share with other folks.
Was that me?
Yeah, can I start with you?
Yeah. So, you know, when was the last time I went to a restaurant?
Right.
Yeah. But I live in Philadelphia in the neighborhood right south of Center City. And my favorite local restaurant is Breakfast Place, the Morning Glory Diner. I highly, highly recommend.
Cool. May I ask you, Nurse Browning, as well? Could you please share your favorite place to eat here?
I would say my favorite restaurant would be in Center City also, and it's Mixto. I just love their margaritas and I miss them. So I'm very much looking forward to having them again someday soon.
One day.
Yeah.
Mr. Garland, if they ever let me in the Pittsburgh with white and green on, is there a place you would recommend I could find a good meal?
Be careful,
like
Mr.
I like Mitchell's Fish Market here.
Oh, okay.
Okay.
Cool. All right, I'm gonna go ahead into our next question. I certainly wanted to do that because I know you guys are real with this stuff. I figured it would get deep. I know it's going to get deeper. I know moving forward, the additional panelists and symposiums that we have are going to get even deeper, especially when we talk about drama and beef and impacted communities and trauma. The next question I want to ask, because of the Dickey Amendment, there was like a 20+ year blockade on CDC funding for gun violence injury research. Now that's been lifted, what effect will future research efforts have on decreasing gun violence in impacted communities? And then what's working and what's not working when it comes to research? Because we did get funding to do some research from the CDC in 2020. The COVID-19 hit, and across the country, there was an influx of gun violence. That's also something I want to say. It's not just Pennsylvania, it's not just Philadelphia. Black communities, poor communities across the country are suffering. There's been an uptick in gun violence from Louisiana to Atlanta. Even in New York, there's an uptick. So it's not just us. This is a problem for Black and brown folks across the country. But again, now that we can get some funding for research, what do you see happening and what are the present challenges for Black and brown communities when it comes to these dollars and this funding for the research? Can I start with you, Mr. Garland?
And you would have to go to me, wouldn't you? So I'm going to, you know,
I could cut if
no,
you.
I'm gonna go. So
Go
I
for
work
it.
at an institution that research here in Pittsburgh. The University of Pittsburgh has. I hate to hear about research because they have researched the Black community to death. And the research, they haven't done anything with the research where it helps the problem. So I have this argument with my colleagues all the time. I'm like, until you get out here in the hood and understand the complexities of the neighborhood, of the people that we talking about, right? Until the data that you are getting, right? You're getting it from, you know, the CDC, but you don't see what's really happening. You know, so I'm trying to get them to look at it from another lens. Now, I do understand and I do believe in the research that we have to do, but you have to get out there with these people to understand the community and what drives it. That's the difference with what I'm doing. The relationships that I have with the community, you know, I can get to certain things. Well, not me, but my team, and we can get to the bottom of some of those things. You know, when I say that I could stop the next shooting, that's based on who I got working the streets and who knows about the different events and who the shot callers are. Excuse me for going into slang again, but understanding who and what are the drivers of that particular community. You can shut it down, and that's the way we start or we begin to change community norms.
And I think a solution to that might have to be getting folks from the neighborhood in some of these administration positions, folks who have varying perspectives. And
Absolutely.
Yeah. Can I go to you, Dr. Kaufman, as well, please? Again, the question was, we're talking about CDC research. You know, for 20-something years, we couldn't get any money. 2020, they started dispersing some funds. Where do you see this going? And what do you see is the impact on Black and Brown communities? And if you have any problems or any solutions or pluses or minuses for some of this research, please share.
Yeah. Well, I have to appreciate what Mr. Garland just said, because I think as researchers and as, you know, I'm part of a ginormous academic institution that sits in the middle of West Philadelphia, and the things that could be said about what Penn has contributed to West Philadelphia probably shouldn't be said in polite company some of the time. You know, we do some good, but that's not all we do. And so I try to be sensitive to that, and I try to think about that and learn from that. And I think as people, as researchers studying gun violence, Mr. Garland is especially right. It's not acceptable. It's not right to go to a community and say, all right, give us all your information. See you later. You know, but I think that's how research comes off a lot, and I don't think how it should be. So I think when we get research funding, we want to be using it, you know, not just to pay my salary, not just to pay my university's overhead. We want to be supporting, we want to be finding out the programs that work. We want to be supporting them. We want to be supporting Mr. Garland and his team, and more people who can do the kind of work that he can do. And look at me, right? So I'm a white woman trauma surgeon, right? I can't do what Richard Garland does, but we don't know each other, but in a way we have to work together, right? And we have to all be a piece of the puzzle. And I think that those research dollars can support the programs that work and can learn from the programs that work. Let me say one more thing though, you know, that CDC ban, it's so interesting, right? So it was actually a ban on the CDC from advocating about gun control.
Yes.
And then that was interpreted as a ban on research. And I just want to think about that for a second, because if you're saying you can't even study this issue or it's going to turn into advocacy, how confident are you really in your side? Like,
Right. And I think it was
a
that.
lot of
and-
this research goes the same direction. Like, guns actually do kill people.
Right.
They really
Do you think with the NRA being a little bit weaker and moving out to Texas, I hope they're out there now. Well, I don't I don't hope that they're out there right now. I don't wish that on anybody. But do you think with the NRA kind of, but moving away, some of the gag laws that you have and some of these things that do hurt folks and some of the pressure that they put on healthcare providers and policymakers, the fear mongering, do you think that there might be improvements in some of this research and doing something about this issue with them not being as powerful as they were in the past? I was just asking you that really quickly,
Yeah.
Dr. Cook.
No, I hope so. I hope so. It remains to be seen. We haven't, for
Right.
instance, right here in Pennsylvania, we haven't passed really much new in terms of gun regulation. And it's not all about gun regulation. It's also about the root causes of violence, which we should talk about more. But,
Right.
but up in, we're hoping that Pennsylvania is going to consider a really effective law, which is a permit to purchase law. It's been proven to reduce violence and death in a number of different states. We don't have it here. We could. I think this is a good moment. Like you're saying, this is a good time. Should be in the legislative agenda this year. And I hope we see real progress there. So keep an eye out for that and keep your representative's ear out for that.
Thank you very much. Nurse Browning, I would like to ask you as well. How do you feel about CDC funding research in Black communities, impacted communities? What works, what doesn't work, and what should we be doing to make it work better?
I really kind of looked into this question a little bit further because I didn't 100% understand the Dickey Amendment. But I just want to explain something, and I think it's key. Like, how does research work, especially in trauma? Like, what all the research we do on different blood types and different, having blood in the trauma bay versus not, and all these different things we research a lot. And I think it's key to know positive things that research has done. So back in the day when I was a kid, seatbelts weren't required. We never had car seats. A kid in a car sat on my mom's lap. So then, a lot of people were dying in car accidents, and then they were looking into why is this happening, and all of this research brought in all of these protective devices that work and have proven to work. So research in trauma does work. However, we aren't really given the financial boost or the assistance to really research gun violence, especially in Brown and Black communities. So why is that? And now that we're looking at potentially getting this funding, what are we going to do with it? The trauma systems in Pennsylvania have been researching this. These numbers are very well known. So, like the city of Philadelphia looks at how many people die from gun violence, but they don't actually look at how many people are affected by gun violence. They don't look at how many people I see in the trauma bay on a month, a year. But we do. We keep that information. We have that information, as does Temple and Jefferson and all of the other trauma centers, Pittsburgh. So, so taking this funding and looking at, why is it happening? Why does it happen more in the Black and Brown communities? Where is it happening? Obviously, we can see that. And then who is it happening to? I used to have the preconceived notion that, these were gang members. This was drug deals gone bad. This is what I saw. This is what I thought. And then, I'm like talking to my patients and it turns out, that guy was looking at my sister's cousin and it's like totally not what I thought. And I don't know, hopefully we're going to figure that out. And I hope that research goes into the community, pulls out why it's happening. I mean, I have my opinions of why it's happening, and then is able to kind of fix that disease before it spreads.
Thank you so much. Yeah, I know folks have just like you and Dr. Kaufman are saying, there's underlying issues, poverty, um, stress, PTSD, psychological disorders. I know folks. I was having a conversation about people in prison and folks not getting. I believe mental health tests are IQ tests, and folks not understanding if somebody can't operate in this world without additional assistance. I think that's a big problem in our communities. There are a lot of people that have trouble functioning intellectually, and they're just kind of out here on their own. And it's so easy to get a gun. The gun laws, you can buy any gun with a barrel of 18 inches or longer here in Pennsylvania without a background check. That's private sale, or private transfer. That's an AKAR. So, the gun laws suck. And then we have folks who need help who are out here on these streets, and they're not getting help. I'm gonna go into our next question. I want to keep this under an hour. We have like 5 more to go. But thank you guys so much for this insight. I think we're getting decent information. The question, the other question that I want to ask is, experts suggest that governmental bodies should declare gun violence a public health epidemic. How do we treat it like such? What does that look like? And what do you expect to be the outcome if a declaration is administered? I'll start with you, Nurse Browning, since you just finished. But yeah, what would that potentially look like? What would gun violence as a public health epidemic or public health emergency or state of emergency look like?
Well, I think that it would
Right.
meet the needs of the community at risk before they come in. So the community at risk right now, for me, is West Philadelphia. That's what I'm seeing. And what about West Philadelphia is causing there to be issues? And if it were a public health crisis, then they would get more funding, they would get more attention, they would get more people involved. This all starts, and my total opinion of everything that is the league here is the education. These guys are coming in shot. Did you finish high school? Or what do you do for a living? Do you work? Nope, don't work. Didn't finish high school. Didn't go past 8th grade. Like, and they don't need chemistry, and they don't need all these big, educational classes. They need, like, how do I get a job? How do I pay a bill? Simple life skills are not being met by these, patients that we're seeing. Making it a public health crisis would bring more resources to the community to kind of nip it in the butt at a young age before, they wind up, without families, turning to gangs to be a family, turning into this continuum of violence that's just keeping on going.
Thank you, Nurse Browning. I'm gonna go to you, Mr. Garland. What would making gun violence prevention, especially for Black and Brown communities, populations, what would making this a public health epidemic, a crisis, a state of emergency? You mentioned legislators. We see all our legislators saying it has to be a state of emergency, it has to be a public health epidemic, but nobody's saying, hey, well, this is how you make it a state of emergency. This is how you make it a public health epidemic. This is what it would look like if it's a public health. And even me having a past in this work, I don't know what it would look like if I were to tell somebody gun violence prevention or gun violence is a public health pandemic, epidemic, crisis. I don't know what I'm saying to folks, what I'm saying that. So could you please help with this convo?
So I'm gonna be really controversial, bro. I really am. Just from the standpoint of the easiest thing for me to get in the hood, I'll get a gun before I get a meal. This is what exists. This is how the community that exists. Just to tell you a little story of there was a 2-year-old, his dad had a gun out, and Well, he wasn't 2 years old. He was a little baby though, and he shot himself. The baby killed. You know, now because I knew the neighborhood that he lived in, you know, everybody was up in arms. Yes, because it was a little baby that died. You know, but I was the one that sat back and said, the community that he lived in, you know, like, what was he having a gun for anyway? And this is real controversial, what I'm getting ready to say. Because of where he lived at, he needed a gun. Until we start changing those community norms, when we talk about poverty, when we talk about the different, you know, housing issues that go on in the Black and brown community, you know, addressing food deserts, you know, food, nutrition, all these things lead to gun violence. For me to say that this man, because of where he lived, he needed to have a gun in order to protect himself and his family. As tragic as it was that this young baby was killed with his gun, you know, he's suffering, the community is suffering. We talk about mass incarceration, you know, who are the ones that are locked up on a daily basis? It's the Black and brown community that really are in the penitentiaries, the majority in the penitentiaries. You know, we have to do, it's a public health crisis. You know, we have to do something around this fact of gun violence and educating people on, you know, let's do away with guns. Let's, you know, I know the NRA wants to do, you know, get everybody a gun. You know, when President Obama was president, they had a run at gun, you know, gun stores, everybody, you know, more people just was trying to get guns because they was talking about it was going to be a civil war, you know. And I'm sorry, I get real, you know, I get real excited when we talk about this, but we really need to understand what happens in the neighborhood. And people think that the only way that they can come out of the ghetto is, you know, with a gun, that a gun could keep them safe or it can make them a lot of money. We got to change that attitude. That's what I mean when I'm talking about changing community norms. And I believe that we can change community norms when they see folks like the folks that you got on this panel working together. You know, that's where I've been able to be successful with the hospitals here in Pittsburgh and Allegheny County, because the trauma doctors like Dr. Browning or Nurse Browning and Dr. Kaufman, you know, taking this on, you know, and you don't have to be African American to address this issue, you know, and when the research is done and when it's done right, we can actually change community norms. We can change the narrative, you know, and we can have identity transformation. But above all, we can stop the apathy that exists in our community. It ain't the white folks. I'm saying in our community, there's too much apathy, you know, and we got to stand up. You know, everybody want to blame everybody else, but we have to be the ones to stand up.
I agree.
Sorry, I'll shut up.
No, thank you so much. Dr. Kaufman, last but not least, what we're making gun violence a public health epidemic, crisis, state of emergency, what would that look like? Yeah, I think it's super simple. What would that look like?
Yeah, so I think we all know probably that it could look like empty words. We don't need a declaration that means nothing. But if we have a declaration, if we have a consensus that brings, yes, the people on this panel, and yes, everybody listening to this panel has a role to play. Our schools have a role to play, our housing, our businesses, our institutions, our community organizations, our religious organizations. Everyone has a piece to play. If it brings everyone to the table, if it mobilizes resources, if it mobilizes evidence, if it breaks through some of the political nonsense that gets in our way, then it's valuable. And it says we get then we get to the root of things. Because I'm an optimist in a lot of ways, and I don't think that violence is anyone's first choice. So people need options, people need opportunities. People do not need to be living in a situation where their young child ends up getting killed because, like Mr. Garland said, they were in that trap where that was the best that they thought they could do to protect their family. So we need to get to the root of it, and we need to come at it from all sides. So to me, declaring a public emergency makes a lot of sense if it's not just empty words.
Thank you so much. It's 8:21 now. Like I said, I wanted to keep this to an hour. I'm gonna ask two more questions. One question I want to ask, and please feel comfortable answering it. Please be open, but legitimately, we want the varying perspectives. What would you consider to be the leading cause of gun violence in Black and Brown communities? Please name some issues that you think, especially during COVID-19, maybe, what do you think is perpetuating this uptick of gun violence in poor communities? Can I start with you, Dr. Kaufman?
Yeah, sure. And so,
because I know, I'm sorry, I didn't mean to cut you off, but I know folks wanted to touch on, the issue is so multifaceted. I know folks wanted to touch on some of the other things, because you can't touch on the health aspect, the trauma aspect, without touching on the other parts. I know this isn't the Varian Symposium, this is just public health, but I do want to get your perspective on what do you think is happening to us? Why do you think this is happening?
Yeah. Well, I mean, I can't believe we got like 52 minutes into a symposium on gun violence at the ACP of Pennsylvania, and we didn't say the root cause of gun violence affecting African-American communities. Anytime there's a racial disparity in something, you know what the root cause is. The root cause is structural racism. You don't get that disparity from anywhere else. And that's manifested in so many ways through those options, through those opportunities that are not available to the people who need them, through the media that doesn't talk about my patients and Rhonda's patients like humans, through the lawmakers who don't care that guns are easier to get than a mint because they'd rather please the NRA. It comes in so many ways. So that it's got a lot of manifestations, and it's, in a way, it's the easy answer, but it is the answer. It's the root of the problem, is the way that racism is built into the structures of our society that doesn't value these lives, these people who have incredible potential that we're losing every single day.
Thank you, Dr. Kaufman. I do want folks to know I'm not prompting these answers for folks, but you know, a lot of people in this space agree, the gun violence prevention space, we agree the structural and systemic racism that has plagued Black people for over 300 years in this country, that I think this is a direct effect of that. Can I go to you, Nurse Browning, as well, and ask what your opinion, again, this is all opinion, this is in fact, this is all what, you know, folks just sharing their perspective, so please.
Well, I do agree with Eleanor, but to not repeat everything that she's saying, I think poverty is one of the biggest issues. The opportunities just aren't there. You know, when you can not get a job making any amount of money that you could support yourself or your family, what other options do you have? So, and I also think another, it's the lack of, and I don't know the right word, so bear with me, but the lack of caring. Like, somebody will shoot somebody without even a thought of it. Like, they'll shoot 8 people at a train station or a bus station, not even thinking that maybe they'd hit a child, maybe they'd hit an older man, maybe they'd hit a pregnant woman, and maybe not hit whoever maybe they were aiming for or whatever. There's no, it's just like, you know, like I would brush my teeth, somebody would just shoot somebody and not There's a lack of that, and I don't know the right word for that, and I don't know where you get that, where you where do you learn that? And I believe that is learned in the family at a young age, and it's brought up. And I feel like, you know, the family situations aren't great in West Philly, and I'm sure in North Philly. And I think that's actually adding to the issues too. But poverty, I think, is our biggest issue there.
Thank you so much. Really quickly before I get to Mr. Garland, I do want to share that comment you made about folks not caring about life. If you look on Instagram, I'm gonna share this with everybody. If you look on Instagram, if you look at some of these guys, some of these young people, they're almost even proud of engaging in this violence, almost considering themselves to be demons. That's a hashtag. You'll see a name like Walk Down such and such, and these are almost young people like glorifying walking down on somebody and shooting them. Even with folks keeping score with lives, one up is a term. We're one up right now. And that means if somebody, look, can I go to you, Mr. Garland, really quickly? I don't want to share too much because this isn't about me, but more so you guys. But yeah, could I ask you what do you think is our biggest plight when it comes to gun violence in Black and brown communities?
Everything that the two young ladies
Right.
said, everything that they said, but then at the foundation of almost every shooting, drugs and alcohol is at the foundation of just about every shooting that we have. When you talk about that, some of these young kids don't have no feeling, you know, it's because of the drugs that they're using. And I think that at the foundation of any problem that we have in America, drugs and alcohol is at that foundation. You know, we need to do more education. I remember, I don't know what administration, when they said no more drugs, no more gang wars, no more drugs. You know, we need to have campaigns like that. We need to keep doing different things, you know, to get young people not to go down this road, because everybody right now think it's cool to smoke weed. You know, now that you got kids talking about they going to get weed cards. You know, I mean, as crazy as that sounds, you know, that's legit now, you know, but that can't get them a job. That can't get them a job in construction. That can't get them a job in the hospital. That can't get them an education. You know, we have to be better at educating our children and the community around this issue when we talk about gun violence, because everybody thinks it's all right to have a gun. You know, so if you have a gun, you know, whether you going, you know, whether you carrying it or not, you're going to use it in a situation. And if you hide, ain't no telling how that situation is going to turn out.
Thank you, sir. We're at 8:28. I did have one last question, but again, I know folks are busy. We're in the middle of a snowstorm. Thank you guys for all of your input. Thank you guys for being a part of this. Like I said, we weren't looking for the answers to any of this. We just wanted to start to have a conversation for resistance. Does anybody have any final remarks or a statistic? That the last question was really quickly, and we could probably do it in under a minute, but do you guys have any imperative statistics that you want to share that we should be sharing when advocating and talking to people about this issue from a public health aspect? This is being recorded. I know there were a lot of statistics from you guys already. I'll go back out and send minutes to folks who participated and folks who didn't participate. But I wanted to know, is there any additional statistics that you want us to share when advocating and conveying the priorities from the public health aspect?
Well, real quick, because I know Eleanor really has true statistics.
Right.
But I will tell you,
right.
the statistics that the city of Philadelphia is giving you does not match what we are seeing in the Trauma Bay every single night.
Wow.
They don't equal. So there's no way the math is there that the amount of people that I see shot are not the same numbers, even though the city's saying our numbers are up, but they're the numbers of people who didn't make it. They're the numbers of people we didn't get to save. And we're good. I mean, I got to tell you, we're good.
No,
We,
I know.
the people that come in and I think there's no way this guy is going to make it. And then they walk out and, I always give them a line. They got to bring me pizza back. And they do. I saved you. You got to bring me pizza. So these numbers aren't matching up. And that needs to be addressed. Just because they're not dying doesn't mean this isn't happening.
Right.
And that's what I'm witnessing. But Eleanor has good numbers, I'm sure.
Okay. Dr. Kaufman, really quickly, please.
Yeah. Well, I was thinking about this because you did give us this question in advance, and I had something really depressing. And I was like, no, let me do something different. So there's all kinds of things that we can do, and there's all kinds of things that we should do. So here's an optimistic statistic. The folks in Baltimore, and this was a initiative that came straight out of the community from some community organizers, started this program. It's a different version of the word ceasefire from your former employers, but they started these ceasefire weekends. Everybody's going to get together. Nobody shoot each other this weekend. Simple message. They organized events and parties surrounding this. And on those weekends, compared to similar weekends, compared to what you would have expected, they brought the violence down in half. They cut it in half. And it wasn't like people got shot the next day or the next weekend instead. They just cut it in half. People who would have been hurt, people who would have died, didn't. Simple things, community-driven things, we can make a difference. That's the statistic I want.
Thank you so much. Mr. Garland, is there a statistic that you would like to share before we log off?
Well, not a statistic, but I want to involve the whole community.
Right.
We always talk about it takes a village to raise a child. It's going to take this village to stop gun violence in every community. I mean, I can go to moms, grandmoms that these kids respect. We have to start engaging the community in a different way. And I think that's the way we bring back that old adage where we say it takes a whole community to raise a child. We can do it one community at a time, and every community is going to learn from the other community.
Yes, sir.
That's what I want to see.
Right. Cool. Yeah, President Houston, really quickly, if you could help us sign out, if you could take us home for the evening, that would be great. But thank you guys so much for being a part of this. I'll probably look to have another conversation with you guys again. The insight was awesome. It's just what I wanted it to be. I was shaking my head and smiling because you folks were giving the answers that I wanted folks to give. But so thank you all so much. And President Houston.
Well, again, and I think Michael hit the nail on the head. Thank you all very much, Nurse Browning, Dr. Kaufman, and of course, Brother Garland. This issue is an issue that we must be honest and true in our communities about. One of the things that when I was sitting there listening to all three of our great panelists and speaking about the issue of gun violence, I think there has been a serious moral and value deterioration that has been happening in our communities for quite a long time. It was Nancy Reagan and the Reagan administration that really started to tackle this issue of just say no to drugs. And, a lot of times, and I think Brother Garland said it, and I'll end it on this note is that when you look at the issues around violence in Black and brown communities, he hit the nail right on the head. It's economics. A lot of these communities have been deteriorating for quite a long time. Black and brown communities, I can speak to here in Pittsburgh and the surrounding areas. When they shut down the mills, there was no plan B. It was close the mills, get rid of all the steel industry and the industrial aspect of vibrant communities. And there was no plan B. A lot of our young people are Black males, and let's not be ignorant. There are Black females too that are driven by some of this violent stuff as well. And I hope, and I really do hope that we do have another forum like this, Brother Michael, because the importance of this is speaking truth. And I think a lot of times we try to pretend like this stuff really isn't happening. And we turn on the news and we see 8 people got shot in Philadelphia. And, you know, I'm fortunate enough now I can get the Philadelphia news and I see what's going on. And to what, again, there's a lot of apathy to this. It's become the norms. And until we really say, ladies and gentlemen, folks, this is not normal, change is not going to come. And we got to start, you know, I think in education, they say you got to start really dealing with children at 3rd grade. Guess what? We got to catch them in the cribs, in the bassinets. That's when we got to start catching them now. We can't wait till 3rd grade. We can't. We got to catch them right out of mom's womb, right there. Okay. So yes, we do need to have these conversations. And I think that in the NAACP of the Pennsylvania State Conference, Pennsylvania is an extremely unique state. We got Philadelphia, Pittsburgh, Harrisburg, Allentown. We have a lot of communities that are having these issues, Mike. And until we get serious about really talking about it, and being honest with ourselves, change is not going to come. So on behalf of the Pennsylvania State Conference, NAACP, Nurse Browning, Dr. Kaufman, and
Right, it froze. I see other folks moving.
Yeah,
Uh,
bro.
I'm sure he was saying thank you guys for being on here tonight. I know you guys are so busy. You guys are so patient. The PANACP really appreciates it. I do. Folks from my community do. Folks who want to solve this problem do. And the people who are on here, Ethelyn, Monica, June, Alice, Will, I got to shout you folks out. But thank y'all for being on here. It's a small group, but this was an amazing conversation and real in-depth, really cool people. Thank y'all for what y'all do.
Thank you so much. It was an honor, a true honor.
Thank you. It was nice
Thank you
meeting
so
y'all.
much. Thank you so
Thank y'all.
much. Nice
It's
to
a
meet you.
pleasure. Really, I'm gonna reach out. Of course, I gotta send gifts out and thank you cards, but I'll be talking to you guys about another panel or somehow getting involved or how we can support you in your work from the NAACP. So thank you guys.
Thank you so much.
Thank you.
All right, y'all.